Morning, everyone. So I thought I'd do another walk and talk here with my buddy Otis. Hopefully he behaves himself here. This is a trail that we're quite fond of, and I have him on a leash. I normally have him off leash. He's been doing really good, but there's been a lot of coyote activity around here, and I don't fully trust him to come back if he runs into any trouble. So this video is I'm going to talk about the difference between sympathy and empathy as it comes up in therapy, or the therapist's sympathy or empathy for a client. And this is prompted by something that came up a few months ago, and then more recently a current client made some comments around this sort of thing, and I thought to make a video about it. But so we'll start with a bit of a story. So I received some emails from a potential client maybe a few months ago. They emailed my office rather, and they're looking to book an appointment. They booked an appointment, and then a few days later received somewhat of a frantic, panicky email back saying that they wanted to cancel their booked appointments, saying that they read these horrible reviews about me, and that was that. So I received the email, or it was forwarded to me, and I sent a message to this person and said, look, do you mind letting me know, like, where did you see these bad reviews? It's kind of news to me. I wasn't aware. And they provided a link, and it was kind of some obscure place. It's like, not Rate My MDs, but it's some kind of rate doctor type thing. I'm not a doctor. I don't have a doctorate degree. I have a master's degree, so I don't know why I would be on one of those websites anyway. But there are only like 2 reviews, and they're from years ago. And the comments said something like, Brad is lacking empathy. He doesn't seem to empathize with his clients, and this kind of thing. There are 2 people, I think, that said something like that. Now, years ago, I'd be very upset about that kind of thing, and or worried, like, how could this be the case, and what am I doing wrong, and that kind of thing. But I've been doing this long enough that it doesn't really bother me so much. These things are quite complicated, and people have different experiences and so on. But I was pondering that for a couple of days. What could that be about? Because it's so at odds with how I feel that I am when I work with my clients. So it was a bit bizarre that I'd be considered unempathic or lacking empathy. So I was pondering this for a couple days, and more or less came to a conclusion as to what that was probably about. And then reflecting on some of the comments from clients over the years that would speak to the same issue. So now this is kind of a side point, or it could be a number of issues, let's say. But as a therapist, you want to be careful not to be overly emotional with the clients that you're working with, because for some people, I mean, first of all, you might misunderstand what's going on there. You might be responding to an emotion, or the emotion might be your reaction to something. It doesn't resonate with the client so much. But for some people, that can be quite off-putting, or it can be jarring, or anxiety-provoking. And sometimes the focus can then be about the therapist's feelings or reaction as opposed to the client's, and so on. So these are things that you want to be mindful of as a therapist. I know that there are some newer therapists that follow the channel, so there's that. But I think the main issue comes down to, for me, or what I suspect it is, I could be wrong, of course, and I'm open to the possibility, however unlikely, that I'm lacking empathy or something. But I think the main issue is conflating empathy and sympathy. So I think what this person was maybe expecting, or maybe looking for, or there's certain people that do expect this, or this is what they're wanting. They're wanting someone to be, responding in a very immediate kind of there. Oh, you poor soul, that must be so difficult, and this kind of thing. And I guess for some people, that's kind of what they're looking for, what they're needing. And for me, it's kind of an issue of, like, is it empathy or sympathy? Like, so let's define these things first, maybe. So sympathy, from what I understand, is, in this case, it would be the therapist having a feeling or a reaction to the series of events, let's say, that the client has experienced, and they're maybe responding from that place. So it may involve a bit of a feeling, but it's more about the event or the things that the person is experiencing or going through. Whereas empathy is something, in my opinion, is much deeper. Empathy is more or less, it's a way of being with the client such that you can feel a resonance with what they're feeling. Like you're more or less in that feeling to whatever extent you can be with them. It's a genuine feeling about what they are in fact experiencing. And when I work with people, that's what I'm aiming at. That's where I'm trying to be all the time, or as much as I can be. So for me, sympathy is kind of, it can be a superficial, I don't know, maybe not tunneling down as deeply as we could be. And again, for some people, it's kind of off-putting. So, just to give a dramatic example of this and how it can create some misattunements. Like, suppose someone had lost a parent, their father had died or something like that. And if you don't know that person really, really well, but you're an acquaintance or you know them, to a certain degree, you send them a sympathy card. I'm sorry for your loss, grief is such a difficult time, yada, 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 that kind of thing. And what you're responding to primarily is the event, the event of losing a parent and how difficult that can be. But it may be misattuned with what the client, in fact, is experiencing. Like, it could be the case that that this person is not grieving. And that can be for a number of reasons. But it could be because they're repressing that feeling. Now, if you come in too strongly as a therapist with, oh gosh, that must be terrible, and I'm so sorry for that loss, and so on, it can cause the client to freeze up a little bit or clam up or just feel like you just don't get it, or that's just not where they're at. So it's a misattunement in that sense. Like, as a therapist, I would do if it's not obvious, I mean, if they're tearful and so on, there's a good chance that I'm probably going to be feeling something about what's in the room at that moment. But as a therapist, otherwise, I'd be maybe asking questions. Well, what was your relationship like with your father? And what is the meaning of this loss for you? And how do you feel about it? How do you experience that? This kind of thing, just to kind of prod a little bit more. And there's not a whole lot of, feelings of my own that are coming into the room, because I don't want to presume, what that is for that person. The other thing is that, this in this hypothetical situation, the client may have a relationship with the father such that the father was abusive. The father was maybe a child molester and molested them, in their early years. And maybe it's not a sense of loss. Maybe it's a relief, So there's that kind of thing as well. So again, the difference between sympathy and empathy. So I think some people are looking for, expecting sympathy, and not understanding maybe, or maybe it's just a difference in what that particular person might want or expect, and just how I seem to operate. But don't take my word for it. I mean, so I was reflecting on this, and just last week I had a client that just started working with me, and they'd worked with some other therapists. We're going to go over this nice little beaver dam here. I don't know if you can see that. See how Otis manages here. Come on, buddy. Let's go. So I just started working with this client, And I think it was toward the end of the appointment, I kind of asked them how it went and so on, how they felt about the session, the first or second appointment, and they said, well, it was really good, and they said, I appreciate that, unlike some of the other therapists that they've worked with, that I'm not sort of overdoing it with the empathy and so on. And they said that they chose me because I was a male, and they figure males are just, more stoic and less, over the top with emotions and so on. I don't think it's a male-female type thing. I think it's just more of a technical issue maybe, or just how that particular therapist works. So I want to try to connect into those deeper layers of and truly empathize and be in that feeling as much as possible where my client is. I don't want to make any presuppositions about any of that stuff. But I've had other clients over the years who've said more or less the same thing, and it seems particularly the case with clients who have backgrounds where there's profound neglect and trauma and so on, and again, if you come in with too much of that overly emotional, compassionate, jumping in and pitying or feeling sorrow for a client and all that kind of thing, it's just so off-putting for many of those clients. They don't want that, or that's not where they're at, and so you have to kind of work a little bit on the outside of that stuff and make some inroads there where there's an opening up to a feeling that now the clinician can actually connect with, and it's genuine, it's authentic, it's not contrived, it's not making assumptions about what the client should be feeling, anything like that. So again, I think the difference is likely that of sympathy versus empathy. So for myself, I don't think I'm lacking in empathy, although I will fully admit I'm not quick to just jump in with sympathy and pity and compassion and that kind of thing. I believe that my clients, people that I work with, they have it within them to overcome their difficulties. I don't believe them to be in a lesser position relative to me or anything like that, in their ability to overcome their issues. But yeah, hopefully that makes some sense. Okay, we'll see you in the next one.